Tonight, 13 News can now confirm that many local hospitals have been forced to divert patients away from the emergency rooms and ICUs, largely because they're still dealing with so many cases of COVID.
The information, which is not usually shared by local hospitals, however, was leaked on social media. So our 13 News Verified team has been going over the data, and they've been working to determine whether or not the information revealed there is really true.
Tonight, our senior investigative reporter Bob Siegel is here to explain what hospitals are saying and what this means if you need emergency care.
This is what got lots of people asking us what's going on at Central Indiana hospitals. This chart, which is now being spread widely on Facebook, allegedly shows diversion information for 13 area hospitals, and it claims almost all of them are diverting patients away from their emergency rooms and intensive care units. Viewers are writing Verify to ask, is this true? We can verify, yes, it is true. But let's talk about what it means. Our sources are some of the hospitals on this list, such as Community and Eskenazi hospitals, as well as Indianapolis EMS, the state's largest provider of ambulance service. First, the information in the chart comes from something called MESH, an organization that monitors capacity at metro area hospitals. MESH's executive director would not discuss this chart with us at all, saying this is hospital proprietary information. MESH does not provide this type of information to the media. MESH does share it with hospitals and ambulance services, so they can make sure to direct incoming ambulances to hospitals that have space. Several of those hospitals in Indianapolis EMS confirmed the information is accurate, and someone with access made the chart and posted it online. Where it says open, it means an ER or ICU is taking new patients as usual. Where it says divert, it means the ER or ICU is telling ambulances not to bring them any more patients. This does not paint a pretty picture, according to the chief medical officer at Community Hospital.
Right now, our hospitals, all of them, throughout all of the donut counties, are running incredibly full.
Dr. Robin Ledyard says this shows a disturbing pattern, but it's very important to point out the diversion chart only covers a very specific date and time, 2:28 on Monday afternoon. The diversion status of local hospitals is constantly changing, according to the chief medical officer at Eskenazi.
In the graphic that was seen, it was a snapshot. And a minute later, another hospital could have gone on or come off. But it's minute-to-minute information that guides the ambulance services to know where to go.
So where are we at this moment? Again, it's always changing. But here's what we learned at the moment that we interviewed our experts. At Eskenazi,
we're not on diversion now, but over the last 24 hours, we were for several hours.
And at community hospitals,
I would say in the past week, we've been on diversion probably about 40% of the time.
What is causing hospitals to divert patients? Yes, it is because of coronavirus.
We are seeing a surge that has a steeper slope than we even saw last winter. And so there is no doubt when you see that diversion graph that it is due to this COVID surge.
And at the same time, hospitals are also having trouble finding enough staff. It's important to point out the medical directors say if things get to a point where all hospitals are diverting patients, then no hospitals are allowed to divert patients. And at any point in a truly life-threatening emergency, patients are taken to the closest hospital that can meet their medical needs. So, bottom line, this chart that shows most hospital emergency rooms and ICUs were diverting inbound ambulances to other locations on Monday afternoon, we can verify the information is true. Since then, area hospitals have been operating in and out of diversion depending on how full they are at any given moment. See something online you'd like us to verify? Send us an email at verify@WTHR.com.